Hey everyone, and welcome to the PTCB Prep Guide. We're all about making those tricky pharmacy concepts super simple so you can remember them. And today, oh man, we've got a huge one for your exam: asthma and COPD medications. These drugs are guaranteed to show up, so let's jump right in and get you ready to crush those questions.
So, here's what we're going to tackle today. We're going to break down the must-know drugs, both generic and brand names. We'll get into the key counseling points you'll see on the job, and I'll even throw in some killer memory tricks to make sure all this stuff sticks for exam day.
All right, Section 1, the why. So before we even touch the drugs, we got to understand why we're using them, right? Let's kick things off by looking at the two big conditions we're treating: asthma versus COPD.
Okay, so let's break this down. On one side, you've got asthma. Think of it as chronic inflammation that causes the airways to tighten up. But here's the key word: it's reversible. This is what's often triggered by stuff like allergies or exercise, and you see it a lot in kids. Now, COPD, that's a different beast. It's progressive, meaning it gets worse over time, and the obstruction is pretty much irreversible. The number one cause? You guessed it, smoking. But here's the really important part for your exam. Even though they're different diseases, you'll see a ton of overlap in the medications used to treat them.
So, how do we actually get these drugs to do their job? Well, that brings us to Section 2, the how. We're talking about inhalation therapy. The whole idea is to get that medicine straight to the source, the lungs, as fast as possible.
And when I say fast, I mean fast. Delivering medication directly to the lungs means you get relief within minutes. In the pharmacy, you're going to see three main types of devices: the classic metered dose inhalers, or MDIs, dry powder inhalers, and of course nebulizers.
Now, speaking of those MDIs, let me ask you a question you'll almost certainly see on the PTCB. What's the point of a spacer? You've seen those plastic tubes that attach to an inhaler, right? Well, what do they actually do? Knowing this is a huge counseling point.
Okay, so a spacer is an absolute game changer. For starters, it helps people, especially kids, coordinate their breath with pressing down on the inhaler. But the real magic, it slows down the medicine and breaks it up into way smaller droplets. Now, why does that matter? Imagine trying to throw a baseball through a tiny pipe versus throwing sand. The sand gets through, right? The smaller droplets can travel much deeper into the lungs, getting the medicine exactly where it needs to be. It just makes the whole thing work so much better.
All right, let's get into the good stuff. Section 3, the what. We're starting with the rescue medications. These are the inhalers people grab when they're in the middle of an attack and they need to breathe, like right now.
The superstars of this group are the short-acting beta-agonists, or SABAs, SABAs. Think of your airways like a straw. During an attack, the muscles around that straw squeeze it shut. What a SABA does is tell those muscles to just relax. It opens up that straw so air can get through again. It's that simple. And hey, here's a little trick. Think SABA saves you during an attack.
And here they are, the names you have to know. Like, write these down, make flashcards, whatever you need to do. Albuterol is the king. It is the #1 rescue drug, and you will 100% be tested on it. You'll also see levolbuterol, which is brand name Exopenex, and purebuterol, brand name Maxair. All three of these are your go-to drugs for that fast, immediate relief when those airways tighten up.
Okay, so that's what you do in an emergency. But what if we could stop the emergency from even happening? That's where our next big category comes in. Section 4, the long-term controller medications. These are the drugs people take every single day to keep things under control and prevent those flare-ups.
And the absolute foundation of controller therapy? That's the inhaled corticosteroids, or ICS. Think of these as powerful anti-inflammatories. So if a SABA is like a fire extinguisher putting out a fire right now, and ICS is like fireproofing the house. It works slowly, over time, to reduce all that swelling and mucus that causes the problem in the first place. This distinction, rescue versus control, is so important for the exam.
So let's look at the most common ones you'll see. You've got fluticasone, brand name Flovent, budesonide, which is Pulmicort, and mometosone, or Asthmanex. Now look at that last column. See a pattern? The most important counseling point is the same for all of them. You have to rinse your mouth out with water after you use it. Why? Because if you don't, you can get a nasty fungal infection in your mouth called thrush. Super important.
And you know I wouldn't leave you hanging without a memory trick for that. This is probably one of the most tested counseling points, period. So here it is. Just remember the 3 S's: swish and spit after a steroid. Simple, right? It's a fantastic little rhyme to remember the #1 thing to tell patients about these meds.
All right, next step in our controller family are the long-acting beta-agonists, or LABAs. Now, these are related to the SABAs we talked about, and they also help keep the airways open, but they work for a much longer time. And here is a critical safety point, a huge red flag for the exam. LABAs are never, ever for rescue. They are taken on a schedule for maintenance and almost always with, you guessed it, an inhaled corticosteroid.
And boom, here's the proof. These are some of the most common inhalers you will ever dispense. Look at Advair. It's salmeterol, that's the LABA, plus fluticasone, the ICS. Symbicort, formoterol, the LABA, plus budesonide, the ICS. Breo-ellipta, vilanterol, the LABA, plus fluticasone, the ICS. You see the pattern? They pair them together for a reason. These are for scheduled daily maintenance, not for when you can't breathe.
We've got one more big class of controller meds to talk about, the anticholinergics. These work a little differently. They basically block a specific signal that tells the airway muscles to tighten up. So if they block the signal, the muscles stay relaxed. Easy enough, right? And you're going to see these used primarily for the long-term management of COPD.
The two you absolutely need to know are ipratropium, brand name Atrovent, and tiotropium, brand name Spiriva. And for the exam, you want to connect these drugs with their most common side effects. Think dry mouth, maybe a weird metallic taste. Now, while they're mostly for maintenance, here's a little pro tip. You will sometimes see ipratropium used with albuterol in the ER for a really bad attack.
Okay, we have made it through all the inhaled meds. We're in the home stretch now. Section 5 is all about the extras. We'll look at a couple of important oral meds, and then I'll give you my final top-tier tips for the exam.
So let's talk about leukotriene modifiers. First things first, these are pills, okay? Not inhalers. They work by blocking these little troublemaker chemicals in your body called leukotrienes. Leukotrienes cause a ton of inflammation and tightening in your airways, especially with asthma and allergies. So if you block them, you guessed it, the airways stay more open.
Now the big one, the one you absolutely have to know in this class, is montelukast. You'll know it by its brand name, Singulair. It's a super common pill just once a day for both asthma and allergies. You might also see zafirlukast, which is accolate. The main takeaway for the test is just remember, these are pills. They are controllers, not for rescue.
All right, let's boil all this down. If you remember nothing else, remember these three things. Number 1, rescue versus controller. You have to know that albuterol is for an emergency and something like Advair is for every day. Number 2, counseling is everything. That swish and spit after an inhaled steroid like Flovent, that is non-negotiable. And number 3, know your names. You have to be able to match salmeterol fluticasone to Advair and montelukast to Singulair. Those are guaranteed points on your exam.
Wow, we discovered a ton of ground, didn't we? From SABAs to ICS to combination inhalers. That was a lot of high-yield info. So you ready for a super quick review?
You guys did an awesome job today tackling these asthma and COPD meds. Seriously, you are well on your way to passing that PTCB exam. My advice? Go over your notes, maybe watch this again if you need a refresher, and please practice those drug names every single day. If this helped you out, a like and subscribe would mean the world. We're dropping new pharmacy topics every day to make this whole process a little easier. Keep learning, keep pushing. You've totally got this.